Hi there, Melissa Boudin, licensed clinical psychologist, here to talk a bit about depression, what it may look and feel like, and how therapy may be able to help. First, I want to define the term depression. The term depressed is typically used to describe feelings of sadness, and maybe that is something you are experiencing, and maybe you are worried that you have depression. So what is clinical depression? Clinical depression is an expansion of feelings of sadness and comes with additional symptoms that can cause changes or problems in other areas of your life. Before discussing those though, I think it's important to know that therapy can help in either case, whether you are feeling down, sad, and lonely, or whether you have clinical depression, therapy can help alleviate and improve how you are feeling. So what does depression look like? In addition to feelings of sadness, depression can look like irritability, feeling more tired or fatigued than normal, having trouble concentrating or trouble sleeping, no longer having the motivation to or the interest in doing things that you used to do, even the things that you love to do. It can look like restlessness. It can look like changes in your appetite, eating far less or far more than you typically do. It can also include feelings of hopelessness or unworthiness or guilt, or feelings that life may not be worth living. It can also just feel like a general empty feeling. So when should you seek help, and what might that look like? If you are experiencing any of the symptoms that I just described, and if they are causing a change in your life that you are not happy with, if they are impacting you, causing problems in your relationships, in your work, or with your family, or even if you just want to talk about or even figure out what it is that's causing you to feel the way that you are, then therapy can be beneficial. So what does therapy look like? Therapy for depression often begins by figuring out what the underlying problem is that is causing you to feel the way that you are. That underlying problem may be something from your past, it may be something from your present, or it may be both. In therapy, I work with my clients to determine whether a past or present focused therapy is the best fit for them depending on their individual needs and goals. From there, therapy often focuses on changing and adapting negative thoughts and behaviors and replacing them with healthier counterparts. We also work to incorporate healthy skills for coping with your symptoms and feelings, as well as reincorporating the activities that you once enjoyed back in your life with a gradual process. And I do all of this while focusing in on your personal and natural strengths, using those as a basis for coping in a healthy way. Sometimes we just need to be reminded of our abilities or taught how to utilize them more effectively in order to heal. Ultimately, the goal of therapy is to help you gain confidence in your ability to cope with life stressors and to effectively manage your symptoms, which leads to an overall better quality of wellness and life. So I'm so grateful you took the time today to learn a bit more about depression with me, and I look forward to meeting you in session.